This morning we're here to talk about the Women's Health Program. For several years this program has been providing low-income women in Texas with important preventative health services and screenings. The Texas legislature, as the elected representatives of the people of the state of Texas, they have made it crystal clear that this important program will not be used to give taxpayer dollars to abortion groups and affiliates like Planned Parenthood. This law reflects the clear values of the state. In Texas, we cherish innocent life, and we won't allow taxpayer money to be used to promote or provide abortions through the Women's Health Program. Earlier this year, the Obama administration, which is one of Planned Parenthood's biggest supporters, said that they would pull funding from the Women's Health Program. In response, I promised the women of Texas that they would continue to have access to this important health care, whether it was funded by the federal government or whether it was funded by the state. We're here this morning to announce the new Texas Women's Health Program is ready to go, and also to reassure women across the state that they can and will receive services. Commissioner Janek, who you'll hear from shortly, and his team at Health and Human Services have been working to line up providers across the state of Texas for the state-funded WHP. And I'm proud to say that we now have 3,000 qualified providers ready and able to supply those preventative services and those screenings through the Texas Women's Health Program. I might add that's 500 more providers than what we had in total with the federally funded program earlier this year. So, Kyle, I want to say thank you for the work that you and the agency have done. Well done. So we've not only created a program that meets the needs of Texas women, it also respects life. It honors the will of Texas voters and ensures that no taxpayer money goes to abortion providers and or their affiliates. At this time, Kyle, speaking of you, I'll ask you to come up and just give a little more detail of what you and the agency has accomplished. Thank you.
Thank you. Thank you, Governor. The applause actually is for the folks at the Health and Human Services Commission, the dedicated employees who have been working the phones, through our vendors, through our managed care organizations, through the actual employees of the enterprise who have put together a program that accomplishes three main goals. The first goal, the most important goal, is to see that low-income women across the state who have benefited from the Women's Health Program will continue to benefit from the Women's Health Program. And let me be clear. The first goal, the most important goal, is to make sure that women who need the services get the services, whether it's for family planning purposes or whether it's for preventive care, screening for cancer, and other preventive measures. This program will work. Our second goal is to do it in a way, of course, that complies with state law. The legislature has been very clear on this in terms of how the funding is to go. We've devised a program that will comply with that. The third goal of the program is to do it in a way that brings those Texas tax dollars back home to Texas so that we can continue to partake in the federal funding stream. Now, as you know, there have been lawsuits filed on all parties. I don't know where the courts are going to take us. I can tell you this, that the Texas Women's Health Program is ready to go. If we can do it with the Women's Health Program as a part of the Medicaid funding stream, as we intended to do originally, with the cooperation of the federal government, we will continue to do that with the federal funding. If the federal government will not cooperate and the courts don't make them cooperate, we are ready to go with the Texas Women's Health Program using state money. As the governor said, we've got 3,000 providers across the state who've already signed up. You got to remember we had some rules that were not finished, and even without those rules being finished, we had providers who were ready to say, yes, I want to do this because the women need the services. Once we got the rules straight and we knew exactly what the program was going to look like, the feedback from the providers, the doctors across the state was tremendous, including from our partners at the FQHCs and other private providers and hospitals. The feedback has been tremendous, and we have a program that's ready to go. We like our geography. Our geography will show that we don't have large gaps in coverage, as the old program did not have large gaps in coverage. We want this transition to be seamless. I want the providers to be able to sign up easily. I want the patients to be able to sign up easily. In fact, I want them to see a seamless transition from the old program to the new program if we're forced to do so. So we're proud of the program that the Health and Human Services Commission has put together. I especially have to thank the governor. Governor Perry has made resources available. He said, Janek, I don't know exactly how you're going to get it done, but you got to get it done. And things you need from my office in terms of support, you go make it happen. So I know I've been around government long enough that I salute smartly. Governor and I have been friends for a long time, but I know the look in his eye when he means it, and you better go get it done. Governor, I'm happy to tell you we've got it done for you. And again, thank you all for having us here in Williamson County today.
Kyle, thank you. One of the things that I want to bring to your attention is the program that we're discussing here is one that ensures that Texas women get the preventative services that they need. At the bottom of all of this, that's the most important thing. But it also complies with the law. And it's my hope that those who will be excluded from participating in this program because of their support for abortion will set aside their objections, in the scare tactics that have been going on, and focus on what's truly important. And that's helping these patients get the services that they need and that they deserve. The women in this program should be able to count on them to help spread the word. I would hope that the folks at Planned Parenthood would actually help spread the word that those women can continue on and to find the services, and to that end, that Health and Human Services has supplied brochures and information that will help patients find qualified providers. When this is all said and done, it's those women's health that really matters. And I would hope that Planned Parenthood would respect the will of the people of the state of Texas and stop pursuing these court battles. Now let me be clear. Texas will not allow a program that includes abortion providers or their affiliates like Planned Parenthood to be a provider. And if they file a lawsuit challenging the Texas program, and they were to prevail, they will kill this program. And they'd be responsible for denying these important health services to low-income women in Texas. Such a lawsuit would only confirm that rather than be excluded by this program, they'd rather see no women's health care program at all. And it'll also confirm that their own profits and their pro-abortion agenda are more important than the women they claim to care for. Now, we certainly don't doubt that the WHP funding was vital to their business interest. Already, one Planned Parenthood facility in Abilene, Texas, where abortions were performed, has been shuttered because Texas made a stand. And according to one Planned Parenthood spokesperson, that closing was a direct result of the clinic losing WHP dollars, even though the funding was supposed to go to clinics where abortions weren't performed. The program that we have ready to go will provide access to health care across our state to women who need it, because we made a commitment not to leave them behind.